Hey everybody, welcome back. I'm sitting here with Jan and Lauren, and I was cracking up when you told me about this segment.
Oh, it's good. It's how to go to the dentist. Go back in time, 1869. What would it be like?
I'm
totally scared of the dentist.
Yeah.
I have a new one now, my friend, Dr. Angie. Dr. Angie, and I'm not scared anymore, but oh gosh.
Now smile. Smile. Now smile. See? Now those teeth don't come cheap.
No.
No. Now back in the old days, they wouldn't look like this. Anyway, Dr. Spiker Davis is just great.
He's
got
awesome.
a huge place in his new office that has all this vintage dental equipment.
Where did he find vintage dental equipment?
My dad had two dentist chairs.
Did he?
Yes, and he sold them, and he says that was one of his biggest regrets because he loved collecting that stuff. And my mom was like, "We are not keeping these in our house," so he had to get rid of them.
Okay, now why would he have two dentist chairs?
My dad will drive around the city of Houston and look for stuff, and I say stuff, on the side of the road. And he loves to like refurbish things, and I mean like little children's desks, old school heavy wood. And he will lacquer and paint and do all kinds of stuff.
It's too bad that he got rid of them because
they're probably worth a lot of money.
He sold them for a lot of money.
Stuff.
My dad's sad, my mom's happy.
Well, anyway, I want to take you back in time, everybody, and to 1869, and then bring you up to what is really hot in 2009 as far as dentistry. So let's take a look.
Knock me out.
Just imagine it's 1869 and you have to go to the dentist office and you are having a tooth pulled and there's no Novocaine, there's no pain medicine. Can you imagine what that would be like?
Did you drink your whiskey today? You better have had a bunch.
Is that what they did back in those days?
Absolutely. That was the only way. They just get so drunk they couldn't stand it. Because, I mean, I want you to look at these torture tools. I mean, look at the hook on this thing. I think they just put it in your mouth and just yank it out like that.
You don't use any of this kind of stuff, I know.
Well, we still have some similar things to this when you're going to pull teeth, which look kind of like pliers. You know.
I mean, you still have things like that today, but they're just not so bulky. Right.
And of course, this is rusted and corroded. I doubt they sterilized anything back then. Who knows? Or after they yank your teeth, they could make some dentures, and of course, this one's broken. So, okay, we, put some false teeth in your mouth.
But those are so hard. I'm sure they weren't comfortable.
And if you were going to have a filling, after we drilled out the hole, we would mix up our mercury and our silver in this thing, and then with our fingers, we'd just take it like this and push it in the hole.
And that's
no gloves.
No gloves or anything.
Are you kidding?
All right. Now, what about this?
Of course, this thing here is an old drill.
Show me how that works.
Yeah, it's like an old sewing machine. It used to have a pulley that would come up over here, and the dentist would have to stand here and pump it while he was drilling on your tooth.
So he had to be multitasked in order to do this.
Can you imagine how long it would take for that to, maybe I can get 30 or 40 RPMs per minute or something, whereas the new drills, are like 500,000, so that'd take a little while.
So it wasn't a little trip to the dentist, it was like an all-day deal,
probably.
Now, what you got over there?
This thing over here, we have a lot of little spray bottles, and I don't know what they put in there, kerosene or turpentine or something to hose your mouth down to sterilize it or whatever. And this thing says cautery on here, which is to stop bleeding. It's like electricity. So we would stick, one of these gadgets in your mouth and burn it to make it quit bleeding.
Oh my gosh, it's amazing how anybody survived a trip to the dentist.
How did they live? I don't even know.
This is incredible, this whole little setup here. This is 1869. But now, let's move into 2009, okay? Tell me what's really new, what's going on as far as 2009. Show me what is the latest and the greatest.
The latest and greatest. Well, remember the old days when we used to take an impression of your mouth and we used to stick all this putty goo in there? Remember that?
Yeah. Oh, that's horrible.
Yeah, you gag and you got to wear it for 10 minutes and all that stuff. And remember the days we used to stick all those films in your mouth and take x-rays? Yeah. Now we just have a little gun.
Really? That's an x-ray machine?
That's an x-ray machine right there. Cool. Zappo and you're done, So remember those days?
Sure.
The old ones anyway.
Actually, just recently.
Yeah. It hadn't been that old, has it?
No, that's brand new.
But of course, our latest and greatest machine is called CEREC, and it's a CAD-CAM machine, which what that means is that we can take a digital picture of your tooth.
Okay, let's do it.
Yeah, so if we were making a crown, we'd take a digital photograph. It goes over to our computer, and then we can create a crown on our computer screen. And then when we're ready, we tell the computer to print or to grind a new crown.
Okay, and how long does that take?
One appointment, you're done. So we do all the grinding, no impressions, none of that kind of stuff. And in 10, 15 minutes, the crown's ready, we glue it in, you walk out.
So you take a picture, then you get on the machine, and you work it all out. On the
Yeah,
machine.
got to work it out on the machine.
And then do that.
And then the
Okay.
machine tells the milling center to mill this, and we end up with this.
You take it out and pop it in. For more information on Spiker Dental, check out our website at houstons55.com.